Greetings for the day, and we are going to see an NRP scenario here. This program is being conducted by IAP under the flagship of IAP NRP FGM. Thank you.
Good morning, sir. I'm Dr. Divya from Obstetric Department.
Good morning, madam. I'm Dr. Asif Menezelu.
Hello, sir. We have a patient who has come in early labor, sir. She's 30 years old, primary mother, 36 weeks gestation, sir, now. So we are anticipating labor anytime, sir.
Oh, it's a singleton, madam.
Yes, sir. It's a singleton
How
pregnancy.
is the liquor now?
Membranes have ruptured, but the liquor is clear.
Clear. Is there any other comorbid problems with the baby, mother?
Yes, sir. She is a known case of insulin-dependent gestational diabetes mellitus and also a gestational hypertensive mother, sir.
Okay, madam. We are anticipating delivery maybe another half an hour or
Yes, sir. In
take,
20
madam?
minutes to 30 minutes, we are anticipating her delivery, sir.
Anyway, thanks for the information, madam. We'll try to arrange our team.
Yes.
And we'll be there in another 5 to 10 minutes. Probably we need maybe high risk delivery.
Yes.
Seems to be. So we'll try to come in time.
Okay. Thank you.
Thanks. Hi, Dinesh. Good
Hello,
morning.
sir. Good morning, sir.
Morning, good morning. How are you? Fine. Okay. Just now, Dr. Divya madam called me from ER. One
Okay,
patient
sir.
has come to ER.
Okay, sir.
She's a 36 week. She's leaking since morning. Singleton baby, but liquor is clear only. There is no other risk factors. Mother is a known case of PAH with. She's I think she's an aldomate and she's a radium on insulin also. And she's anticipating the delivery maybe within some 30 minutes. So she wanted us to come and just do the resuscitation if at all needed. Should we all
Yes, sir.
prepared
Very good,
also?
sir. Yes, sir.
Okay. And Dr. Dinesh,
Yes, sir.
you will receive the baby. When the baby is out, you receive the baby and start with the initial steps. If needed, just go ahead with the bag and mask ventilation and all. And you prepared for the intubation also. You keep just doing the intubation also.
Yes, sir.
Are you comfortable with that?
Yes, sir. I'm happy to receive the baby.
Thank you.
And
Thank
I
you,
will do
Dinesh.
that.
Thank you so much.
I will take care of airway and breathing, including positive pressure ventilation and intubation
intubation
also.
also. Fine. Good.
Yes, sir.
Thank you.
I understood
And
the
maybe-
advisor role, sir.
Sorry,
Yes, sir.
understood, no?
Yes, sir.
Fine.
Yeah.
Okay, and if need, I will just help you in just connecting the pulse oximeter in the right hand.
Yes,
And
sir.
whenever you ask, I'll just oscillate for the heart sounds. I'll
Yes,
just
sir.
get back to the values also.
Yes, sir.
And cardiac massage and all needed, I'll just help you on that way also. It doesn't matter. I'm quite confident.
Yes, sir.
No issues in that.
Yes, sir.
And maybe Dr. Shafi, will you be able to come with us for the resuscitation?
Yeah, if you need my help, you just call me, sir. I will come and join.
Maybe yes, sir.
If
Maybe
you
you are busy in the OP.
Yes.
So anyway, I have Dr. Mr. Surya here. I'll tell her to call you back whenever you are needed.
Sure.
Probably you may need to come and help us in accessing the UBL.
Sure.
And if
Right.
needed, some medications, as you know very well, adrenaline and narsalic. We'll keep everything ready. By the time you come, whenever it's needed, I will call you back, sir.
Sure, definitely.
Is it fine for you?
So, I'll come and join you
Thank
when
you so
you
much,
need.
sir. Thank you so much.
Thank
I'll just go ahead, sir. No problem. We'll call you back whenever it's needed.
Thank you.
Okay. Good morning, Mr. Surya.
Good morning, sir.
How are you? Fine?
Yes, sir. Fine.
Okay. And we have an emergency patient in emergency. 5 minutes I got something that come for a delivery. Probably me, Dr. Shafi and Dr. Dinesh will be going, but Dr. Shafi is right now a little bit busy in OP. Probably you have to come with us for helping also. And whenever there is a need for some help, I would like you to call Dr. Shafi. Okay, can you just please note his number also in your this one, mobile number?
Yes.
So whenever there is a need, you just call him also. And I just wanted you for the documentation purpose also. When is the adrenaline given, all these things. But I hope you know that documentation
Yes,
purpose
sir, I
very
know,
well.
sir.
You
Yes,
know
sir,
very
I know
well.
how
Are you
to
comfortable
document.
with that?
Yes, sir. I am comfortable with
You
it.
know, you understand what you're.
Yes, sir, I understood
Fine,
my
fine
roles.
enough. No? Probably another 30 minutes. You should get ready for that. You just make yourself ready for that and just come with us now.
Okay,
It's okay for the
sure, sir.
documentation. Okay, can you?
Yes, I understood my role, sir, how to document and everything. And I will call Shafi, sir, whenever there is a need, sir.
Thank you so much for time us. Okay, let us prepare for the delivery. Come, we'll all hand wash together. We'll follow the same 6 steps of hand washing in 2 minutes. So wear the gloves now. Now we will check the equipments. Providing warm, I would like to switch on the warmer first. I would like to keep it in the manual mode with the heater output of 100%. I'm checking whether the timer is working or not. Hope it is. It's working now. I'm just spreading 2 towels under the warmer. hat is there. For clearing airway, I have a valve suction, and I am just setting it at between 80 to 100 millimeter of mercury. I have a daily suction catheter. I have 10 French suction catheter for suctioning. For auscultation, I have a good quality stethoscope. For ventilation, I have a O2 source with flow meters with oxygen tubings, which can be set to 10 liters per minute. And I have a shoulder roll, and I have a positive pressure ventilation device, ambu bagging. I have a term and preterm size mask. I have 8 French tubing with 20 ml syringes. Dr. Dinesh, can you please check the ambu bag,
Yes,
whether
sir.
it is working or not?
Yes, sir, I'll check it. To fix the mask, keep your thumb inside the mask by rotatory method. Fix the mask and insert the nostril of the mask goes inside as much as possible. To check the bag and mask, keep the mask over the palm, hold tightly and to give pressure. I can feel the pressure over the palm. Pop-up valve going up and down, and bag is self-inflating. These are the methods to check the bag and mask. I am choosing the mask size 1 as we are expecting near-term baby. Sir, bag is working properly.
Thank you, Dr. Dinesh. For oxygenation, I can give free flow oxygen using oxygen tubings and face mask. And pulse oximeter is reading. Dr. Dinesh, can you please switch on the pulse oximeter
Yes,
and
sir.
connect the sensor?
Yes, sir, I have switched on the pulse oximeter. The probe is ready to fix it, sir.
And I have target oxygen saturation. And for intubation, I have laryngoscope, straight blades, size 0 and size 1, and extra pair of batteries, stillet which can be used optionally. Dr. Dinesh, can you please check the laryngoscope, please?
Yes, sir. I lock the straight blade and checking the bulb whether it is working. It's working as we are expecting near term. I am choosing one size laryngoscope blade.
Okay, thank you, Dr. Dinesh. I have endotracheal tubes of sizes 2.5, 3 and 3.5. I have measuring tape, an endotracheal tube insertion depth table, waterproof tape for fixing the ETT, and scissors. And for medication, I have adrenaline ampules, normal saline, and supplies for placing umbilical venous catheters, 5 French UBL, and 3-way stopcock, 2 numbers, and a procedure tray, and a few 2 ml, 3 ml, 5 ml syringes. Dr. Dinesh, can you please start preparing adrenaline now?
Yes, sir, I'll make it. The available strength is 1:1000 dilution. To make 1:10,000 dilution, I have to dilute 10 times.
And make sure you load the saline first, 9 ml, followed by 1 ml of adrenaline.
Yes, sir. I'll take 9 ml of normal saline. Normal saline followed by 1 ml of adrenaline to make it. The dilution is ready.
Thank you, Dr. Dinesh.
And we have to label
Label
it.
it, please.
Yes, sir. I have labeled it, sir.
Thank you. The additional equipments we may need to use during resuscitation are TPS resuscitator, can be used for both term as well as preterm babies. And the oxygen and a blender, it can be used for babies less than 35 weeks. And plastic wraps that can be used for babies less than 32 weeks. Baby delivered.
I'm receiving the baby.
So Surya, please switch on the timer.
Yes, sir.
Dinesh, please visit the baby.
Yes, sir.
Baby looks firm, but tone looks hypotonic only, and baby not breathing also. Can you please start initial steps, Dr. Dinesh?
Yes, sir. Please clamp the card and I am shifting the baby. I'm shifting the baby to warmer.
Sister Surya, can you please counsel the mother regarding the baby's condition, please?
Providing the warm.
Yeah, and get back to me, please, fast.
Position airway. I'm clearing the airway. Putting suction. I'm drying the baby. Removing the wet liner.
Oh, thank you, Sister Surya.
I'm stimulating the baby by rubbing the back. Assessing the baby.
Dr. Dinesh, baby is still not breathing. Can you just start with positive pressure ventilation, please?
Yeah, I'm starting positive pressure ventilation. I am applying the mask from the chin to
I'll
nose.
check the heart rate for you now.
Yes, it covers nose and mouth. It's not covering the eyes with the right size of the mask. Breathe 2, 3. 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 Breathe 2, 3.
Heart rate is not
Breathe 2, 3.
increasing.
Breathe 2, 3.
Chest movement is not
Breathe
there.
2, 3.
Can you
Breathe
please
2,
go
3.
for ventilation corrective steps?
Yes, sir. I'll do the ventilation corrective steps. So MR SOPA, and first I am doing MR. So reapplying the mask and adjusting the mask and giving tight seal and slightly extending the neck to reposition the head. And I am starting positive pressure ventilation. Breathe 2, 3.
I'm
Breathe 2,
connecting the
3.
pulse.
Breathe 2, 3.
Pulse of the
Breathe 2,
probe
3.
now.
Breathe 2, 3.
The right upper
Breathe 2,
hand.
3. Breathe 2, 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 3.
Chest is
Breathe
still
2,
not
3.
rising, Dr.
Breathe 2,
Dinesh.
3. Breathe 2, 3. So I am doing SO. I am doing suction in mouth followed by nose. Opening the mouth and starting again positive pressure ventilation. Breathe 2, 3. Breathe 2, 3.
Sister Surya,
Breathe
can
2,
you
3.
please call Dr.
Breathe 2,
Kapi, sir,
3.
to come
Breathe
and
2,
help
3.
us?
Breathe 2, 3. Breathe 2, 3. Breathe 2, 3.
Still chest is not
Breathe
rising.
2, 3. Breathe 2, 3. Sir, I am increasing the pressure. Breathe 2, 3. Breathe 2, 3. Breathe 2, 3.
Now the
Breathe
chest
2,
is
3.
there.
Breathe 2, 3.
We
Breathe 2,
continue
3.
PPV
Breathe 2,
for
3.
30 seconds,
Breathe 2,
Dr.
3.
Dinesh.
Breathe 2, 3. Breathe 2, 3. Breathe 2,
Sister
3.
Surya, please alert
Breathe
us
2,
at 30
3.
seconds.
Breathe 2, 3.
Okay,
Breathe
sir.
2, 3. Breathe 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 2, 3.
Dr. Shadi
Breathe
sir is on the way.
Breathe 2, 3. Breathe 2,
thank
3.
you. Thank you
Breathe
so
2,
much,
3.
Surya.
Breathe 2, 3. 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 Breathe 2, 3.
seconds over, sir.
Breathe 2, 3.
Let me
Breathe
check
2,
the heart rate,
Breathe 2,
Dinesh.
3. Breathe 2, 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 3.
Heart rate is only 4 in 6 seconds.
Breathe
That is
2,
40
3.
per minute.
Breathe 2, 3.
Dinesh, let us go for chest
Breathe 2,
compressions
3.
now.
Breathe. Yes, sir. We'll
Before that, we'll
intubate.
prepare for intubation also.
Yes, sir. We'll intubate the baby, sir. Holding the laryngoscope on the left hand and holding the ET tube on the right hand, irrespective of the handedness. Inserting the laryngoscope from the right corner of the mouth and towards the left side of the baby. What we are seeing the structure is esophagus. To visualize the vocal cord, pull out the laryngoscope little until visualize the vocal cord. If you are seeing epiglottis, insert the laryngoscope blade between epiglottis and the base of the tongue and lift the tongue, and you can visualize the vocal cord. Once you visualize the V structure of the vocal cord, insert the ET
Don't
tube.
go through the laryngoscope blades channel.
Thank you, sir, to pointing out. And I am inserting the ET tube from the right corner of the mouth. While inserting the ET tube, visualize the vocal cord and insert the ET tube. To confirm, the ET tube is going through the.
Dr. Dinesh, take care not to insert the upper gums, please.
Yes, sir.
Okay.
Yes, sir. I intubated the baby, sir.
Good, Dr. Dinesh.
I'm taking out the blade and Unlock the laryngoscope.
It's good, Dr. Dinesh. You have intubated within 30 seconds. It's really good.
I am holding the AT tube against the hard palate.
Dr. Dinesh, you continue positive pressure ventilation now.
Yes, sir. I will continue positive pressure ventilation.
Please continue.
Breathe 2, 3. Breathe 2, 3.
I'll just
breathe
check the
2,
air
3.
entry for you.
Breathe 2, 3. Breathe
Chest
2,
is
3.
nicely rising.
Breathe 2, 3. Breathe 2, 3. Breathe 2, 3. Breathe 2, 3. Breathe 2, 3.
Fine.
Breathe
Air
2,
entry is
3.
equal
Breathe
bilaterally.
2, 3. Breathe 3. Breathe 2, 3.
Now
Breathe
I'm
2,
going to
3.
measure
Breathe 2,
NTL.
3. Breathe 2, 3. Breathe 2, 3.
Nasophageal,
Breathe 2, 3. Breathe 2, 3.
from the middle of nasal septum to
Breathe
the
2, 3.
tragus
Breathe 2,
to know the depth of the incision of ATT.
Breathe 2,
It is 8 centimeters now.
Breathe 2, 3. Breathe 2, 3. So NTL plus 1, 9 centimeter. I am fixing at 9 centimeters, sir.
Thank you, Dr.
Breathe 2,
Dinesh.
3. Breathe 2, 3.
I'll just secure the
Breathe 2,
ATT
3.
now.
Breathe 2, 3. Breathe 2, 3.
So,
Breathe
Surya,
2, 3.
can you
Breathe
please
2, 3. Breathe 2,
connect
3.
100% oxygen now?
Breathe 2, 3.
Okay, sir.
Breathe 2, 3. 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 Breathe 2, 3.
Connected oxygen to the bag
Breathe 2, 3.
at a flow rate of
Breathe
10
3.
liters per minute, sir.
Thank
Breathe 2,
you.
3.
Let me check the air entry bilaterally now.
Breathe 2, 3. 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 Breathe 2, 3.
Air entry is good bilaterally. We'll continue for 30 seconds.
Breathe 2, 3. 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 Breathe 2, 3.
Mr. Surya, please let us know at 30 seconds.
Breathe
Okay,
2,
sir.
3. Breathe 2, 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 3.
30 seconds over, sir.
Breathe 2, 3.
Let me check the heart rate now.
Breathe 2, 3. 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 Breathe 2, 3.
The heart rate is still 40 only.
Breathe 2, 3.
To continue bag and mask, I'll
Breathe
just
to the-
start with chest compressions now.
Breathe 2, 3.
I have arrived. How can I help you?
Thanks, sir. Can you please prepare for the UVL access, sir, please?
Thank you.
So I'm just starting chest compressions now. I'm doing thumb technique. I'm placing both my thumbs in the lower third of the sternum, below the imaginary line joining the nipple. Other fingers is encircling the baby's body, and avoiding injury to the sternum. I'm just compressing the chest at the 2 and 3 and breathe in. 1 and 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 2 and 3 and breathe in. 3 and breathe in. 1 and 2 and 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 3 and breathe in.
I'm going to prepare umbilicus venous access in a sterile area. I have prepared a sterile area here, and I've got a cannulation tray with me. Mr. Surya, can you please give me umbilicus venous line of size 5?
1 and 2 and 3 and breathe in. 1 and 2 and
Give me 3-way cannula
2 and 3 and breathe in. 1 and 2 and 3
and give me 5 ml
3 and breathe in.
syringe.
1 and 2 and 3 and breathe in. 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 1 and 2 and
Give
3
me
and breathe in. 1
normal
and 2
saline.
and 3 and breathe in. 1 and 2 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 and 3 and breathe in. 1 and 2
I'm going to
and 3 and
take
breathe in.
5
1
ml
and
of
2 and
normal
3 and
saline.
breathe in. 1 and 2 and 3 and breathe in. 1
I have taken 5 ml normal saline. Now I am going to flush my umbilicus venous catheter. I have attached 3-way cannula and then I attached the catheter. Now I am going to flush.
1 and 2 and 3 and breathe in. 1 and 2 and 3 and breathe in. 1 and 2 and 3 and breathe in. 1 and 2 and 3 and breathe in.
Catheter.
1 and 2
And now I am
and
going to
3
flush
and breathe in. 1 and
the
2 and 3 and breathe in. 1
catheter.
and
Now
3 and breathe
I am
in.
ready with my
1 and
umbilical
2 and
catheter.
3 and breathe in. 1
Mr.
and
Surya,
2 and
can you
3
please give me
1 and
another
2 and 3 and breathe in. 1 and
1
2
ml
and
syringe,
3 and breathe in. 1
3
and
ways
2
stop
and
cock,
3 and breathe in. 1 and 2 and 3 and breathe in.
and
1 and 2 and 3 and breathe in. 1 and 2 and 3 and
adrenaline,
1
which
and
is
2
already
and 3
prepared
and breathe in.
in the
1 and
enamel
2
syringe.
and 3 and breathe in. 1 and 2 and 3 and breathe in. 1 and 2 and 3 and breathe in. 1 and 2 and 3.
Now I am going to load
3 and breathe in. 1 and 2 and
1 ml
1 and 2 and
from the already prepared 1 in 10,000 adrenaline.
1 and 2 and 3 and breathe in. 1 and 2 and
I am
3
going
and
to
breathe
take
in. 1 and
1
2
ml
and
of
3 and breathe in. 1 and 2 and
adrenaline
3 and
from
breathe in.
already
1
prepared
and
10
2 and
ml
3 and breathe in.
of
1 and
1 in
2 and 3
10,000 dilution.
1 and 2 and
Now
3
I
and
have
breathe in.
taken
1
1
and 2
ml
and
now.
3 and breathe in.
Now I am
1
going
and
to
2 and 3 and
attach to
breathe
the
in. 1 and 2 and 3 and breathe in. 1
stop cord
3 and
three
breathe
way.
in. 1
Now I am
and 2
ready
and
for
3
the
and breathe in.
UV
1
line
and 2 and
insertion.
3 and breathe in. 1 and 2 and 3 and breathe in.
1 and 2 and 3 and breathe and 1 and 2 and 3 and breathe and 1 and 2 and 3 and breathe.
I am ready with the
1
preparation
and
for
2
umbilical
and
line.
3 and breathe and 1 and 2 and 3 and breathe and 1 and 2 and 3 and
1
breathe
minute
and
over, sir.
1 and 2 and 3 and breathe and. Let me check the heart rate. Pulse oximeter is not picking up. So heart rate is 40. We need to go for drug administration anyway, as planned. I'll move to the head end of the baby so as to give access for you to for the line access.
I'll quickly clean the periumbilical area
Start
with
this
umbilicus.
compression. 1 and 2 and 3 and breathe and 1 and 2 and 3 and breathe and 1 and 2 and 3 and breathe
I'll
and
put
1 and 2
umbilical
and 3
tie.
and breathe and 1 and 2 and 3 and breathe and 1 and 2 and 3 and breathe and 1 and 2 and 3 and breathe and 2 and 3 and breathe and 1 and 2 and 3
Now I am going to cut the umbilical cord
3 and breathe and
2 centimeters
2 and 3 and breathe and 2 and 3 and breathe
level.
1 and 2 and 3 and breathe and 1 and 2 and 3 and breathe and 2 and 3 இப்படி ஆரம்பிச்சிடுறேன் 1 and 2 and 3 and breathe and 1 and 2 and
I am going to insert
breathe and 1 and 2
UV
and 3
line.
and breathe and 1 and 2
I am
and 3 and
identifying the
2 and
umbilical vein which is very
3 and breathe and 2 and 3
deep,
and breathe and 1 and
collapsible, and I am inserting the UVL up to 4 centimeter. And yes, I am.
breathe and 1 and 2 and 3
I am going
and
to check
breathe
the
and
back
1
flow.
and 2 and 3 and breathe.
Yeah, I am getting the backflow. I got the UV access.
1 minute over, sir.
Second, you will check for the heart rate. There is no breathing efforts. Pulse oximeter is not showing the, not picking up the signal. So heart rate is heart rate is 40 for 6 seconds. So I'll go back to earlier position. Shafiza, can you please give? Baby appears to be 3 kg. So can you give 0.3 ml of adrenaline?
Yes,
Followed
I
by
am
your
going
first
to give
1 and
0.3
2 and
ml of
3 and
adrenaline, followed by normal saline flush of 3 ml.
Now,
Given?
Dr. Sister Surya, can you tell me when it is 1 minute?
Okay,
1
sir.
and 2 and 3 and breathe and 1 and 2 and 3 and breathe and 1 and 2 and 3 and breathe and 2 and 3 and breathe and 1 and 2 and 3 and breathe and 1 and 2 and 3 and breathe and 2 and 3 and breathe and 1 and 2 and 3 and breathe and 1 and 2 and 3 and breathe and 1 and 2 and 3 and breathe and 2 and 3 and breathe and 1 and 2 and 3 and breathe and 2 and 3 and breathe and 1 and 2 and 3 and breathe.
1 minute over, sir.
So the pulse oximeter started picking up the heart rate with a good pulse waveform. So the heart rate is 87. Stopping the chest compression. Continuing with positive pressure ventilation. For next 30 seconds. Breathe 2, 3. 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 Breathe 2, 3.
30 seconds over, sir.
We're going to watch for the respiratory efforts. Can you hold the positive pressure ventilation for some time? Let me assess. There is some respiratory efforts, but so the heart rate is 115 and saturation is 95%, 94-95% at the end of 5 minutes. So I think it's above the target range. You can start giving positive pressure ventilation and you can start reducing the oxygen. Now we are at 10 liters per minute. So we are going to reduce it to 5 liters and with the watch on the saturation. The saturation is good. Continuing with positive pressure ventilation. and preparing to shift the baby to the NICU for post-resuscitation care.